Sorry, abusiafo, emamu akwa babio. Ede moba my health checks, saving lives with my honorable doctor Bobson Ateko. I want to say for him ma. Mese me diane afro songstress Lily M. Utimi so twa me frame. Maame Colors. Ai, o frame sa so a. Mecho so na yabo. Yaba mu anasa yapom ana yempom ahoden eho asem. And so me say, me bia doctor be sra me fie bia no. Na asem a ye ka wo hafa ya hoden ho no. Ya na mu odu yie. Nti sa fe no waba na me sra say like page yi wate. Won like page ni so wie nso a. Na wa share. Awo YouTube fie anso a subscribe it. Ahana yen like keke yes subscribe it. Yes one was say like aka ho. Na fe wa share it on all the platforms. Say the be amanfo so a omo pe apomodem pa no wonom so asua dwumadie ho no mafamu aba. No mo de abo wonom bra. TikTok Lily MTV. Sanso na Facebook nso Lily MTV. Instagram ebinom twa na short friend no IG and also Lily MTV. Abusiafo dwumadie a ye hwe my health checks yi osede ben. Emprapi anam predodo sen na me no mienu. Ye ko hwehwe ya pom. Are you your own doctor? Wangasa o check wo ho. Ehunu se enema bi nkoyie enu nti se utu America ekọ doctor ho na okobusa sabio wapom dimu ensem. Se wonya saade a na my health check say uti adwumade awie a na watu America na wakohunu doctor na waka doctor ne adui die esese mbehwe mapom din ho ensem na mebusa nsem na metin mama pomudin mu agina brane na metina tena wiase ache na me ho abamfaso ama amansan adofo bi ana adwumakuo bi adawoma ene wonom so masene na metumi de dwumadi de brewo Hyper salon die wonom doso ana se nkropata na bebre ewo nkrankrom ha sei omadawoma ene omoye meti fefefe. So I have me ya me try me colors kama baby pink. Me say friends this season there me call baby pink. If we hairport salon ho hairport for any short hair nkwa na ono mu yo omo ye tiri bia wo ye bema so a obetimi akọ hairport salon screen na say me wo so omo number na etwagu ho omo de na frɛ omo na ono nom nya wo mmoa. Steam group of companies mwana Steamer Records ye shem ai wonum bo me chidom the numbers ni go screen so say dem aka na wo the number bi a wo pe bia no hwe screen ase obetimi afre wonum na oma ye omwa. Golden Palace Hotel Limited. Golden Palace e Wasamankase Jamestown e hwan so na Lily M Palace Event Center e wo odofo wo modia na kwa Wasamankase Jamestown na udu ho na ubusa Golden Palace Hotel a ombedum wa yo mwa na hwan so na Lily Palace Event Center wo event bi a wo ye bia no bomode ane ko ho is a very beautiful place na omonso enhwe wo kama Lily's Beat Hub dear e fa beats bia se odi to komu odi to wasene mu odi gu nsa anasa wo nan ye meya ye pe life yi bomode ase wo be fa mo number no go screen so na wa friend Lily's Beat Hub na onom nso ahwe wo kama odofo enne ensem a ye be ka no dwumadi iso eya asem hia papa sa ya dia ye be ka ho asem nei eya dia ekum nipa ya ne ya adwene po ye se nkokora nko an eku wo manemrante kwa nyina da ya dia eku mo enne my health checks me honorable doctor say obeka hypertension ho asem doctor I me so ye honorable so de wo ye honorable ampa me da say so what too much ama mansan nyina fi say yade a ana sapomuden ya de ho hia papa enti ye da wase papa se wo de ho ache amansan doc ena de ebeka ho asem me pese wo ka ho asem na de won po na wo pese wo ka enti mi pursue mo aka hypertension me le na me say hypertension na enye ne ya wo ye set topic we na wo beka ho asem yi na ma dwe me say you know pressure and I say yaka pressure ho asem high blood pressure me boa na me say no ano no enti say ye no ade na hypertension no so na asem te say ni
okay enti me that's it once again for
okay thank you too
say yaka hypertension
okay
hypertension no ebinum to be my friend no high blood pressure
okay
but say your diagnosis of hypertension
okay
na say you have a persistently elevated blood pressure and I say high blood pressure that is what's persistent
okay
and see like when your blood pressure is consistently high now that is when you'll be diagnosed of having hypertension and see there are ranges like BP ranges are diagnosing hypertension based on the person age and baby or free but generally speaking like in Ghana local guidelines I can say be less than 60 years if your BP is persistently above 140/90
140/90
systolic no greater than or equal to 140 diastolic no so greater than or equal to 90 persistently so consistent readings so if it's consistently above 140/90 and then you are the age your age is less than 60 years you can diagnose you of hypertension and then if you're above 60 years that is when the range is persistently above 150 so then be 150/90 so that is 60 years and above but aside that generally speaking I think very young children so we have hypertension in very young children sometimes 2 years and above 5 years they also have their own ranges that they use sometimes like up to like from 2 years to 5 years if it's above like 110/70 they can diagnose you of hypertension that kind of thing. So it's like depending upon your age and that range is something normal but it's when the blood pressure is persistently elevated now and then I better diagnose you of having hypertension but there are so many factors that can elevate one's blood pressure usually before you do the diagnosis you have to make sure that you rule a lot of things out so generally speaking you have primary hypertension primary hypertension that's what first used to known as essential hypertension that is primary and then it was secondary hypertension the secondary hypertension is usually due to Arabia or and some underlying condition that you may have then are predispose you to hypertension so a lot of times sometimes some kidney diseases be bit when you hypertension or more some endocrine disorders be bit hypertension if it be fucocytoma it's as a tumor produces a lot of steroids bit when hypertension or more in steroids nowadays lately I've noticed that the very young ladies a lot of them are taking these steroids, the dexamethasone. It comes in several brands, dexazone, there's a cortin, those things. Because of the property of the steroid, it causes fluid retention so it's like they gain some amount of weight in certain areas. So a lot of girls are now into it like they are taking those steroids, but those drugs can predispose you to hypertension. And then to gain weight.
Like
he wants to get some kind of that kind of thing. And sometimes even herbal preparations, they mix them with some of these steroids. And now steroids is over the counter, so you can even buy without a prescription.
Oh, I see.
So young ladies have been buying it's not moon, but that medication generally supposed to be a prescription medication. And now you don't even stop abruptly and you don't even use for a long time unless you have certain conditions. Usually you do it for short courses. Now you have to even taper it down. So when you're taking side drugs, there are a lot of precaution that they give you, but they just take it and take it anyhow. Which means continuously for 3 months now. And then that puts you at great risk of getting hypertension. Yes. So this is one way that I can caution these young ladies and then other things. If you want any therapeutic benefits, if you want to gain another thing, see professionals, see healthcare professionals, let them guide you as to what you should do. but I don't think the steroid is the right way for you to go, like because of the risk now.
I see. I see. Wow. I see. A man mo hwɛ me no. I think say mo tie the doctor ɛka no. No na yɛ no na yɛde pɛto akɛseɛ no. Ewie be wiase no. Na wakote hypertension ɛde ama wo ho. Nti doctor, I think that is one of the causes especially younger ones enya hypertension no. Nti causes na be any day because I need you to outline the causes that maybe hypertension, you know.
There's the primary hypertension and I say essential hypertension. And there was secondary one.
Okay.
Primary one, the main cause of primary hypertension, like, it's not really known yet. It's not really known. Like, there are still studies ongoing to know exactly what causes primary hypertension.
Okay.
But there are certain risk factors, right, that they've noticed in populations that have hypertension.
Okay.
So there are common risk factors that is usually that people with hypertension they share. So now there are a list of risk factors that can predispose you to getting hypertension.
Okay.
But as in the exact cause of primary hypertension, that one is still not really known.
Okay.
But for the secondary, as I said, it may be due to some a disease that you may have, a certain condition that you may have, or medications that you are persistently taking.
Okay.
Aside the steroids, the decongestants, ephedrine, decongestants, some people really use it too much.
They abuse it.
So those medications too can greatly elevate your blood pressure. So that is secondary. So secondary hypertension, there, if you take out what is causing the persistent elevation, your blood pressure will come back to normal. But for the primary hypertension, since we do not know exactly what is really causing it like that, usually such people have to be put on medication. Or sometimes if you do some lifestyle modifications, it's also able to sort of manage. So some of the risk factors that can predispose you to hypertension. So the most common one is aging. So as you are aging, your risk of developing hypertension also increases. So like age is one of the major risk factors of hypertension generally, because as you age, naturally, right, your blood vessels become weak and they don't become as strong as it's supposed to be. So the ability for your blood vessels to expand and then relax, naturally, when you are growing, because of the weakness in it, the blood pressure control, a little. That's why I've noticed that when I was talking about the range for the elderly, they put the range as 150, because generally their blood pressure may not be as low because of the weakness in their blood vessels. So usually when you're getting elderly, you're not really in a rush to drop your BP so much, but it has to be in a particular range all the time to ensure that that kind of thing. So aging is one of the major. So in Ghana, from statistics, you have from 60 years onwards, you have a high percentage of people above 60 years having hypertension. A greater proportion of people above 60 years having hypertension.
I see.
And then so it's something that's very common, especially in our local setting, our Ghanaian setting. And then now hypertension is even estimated, it's costing about yearly, the worldwide, hypertension kills about 7.1 million people every year.
Wow.
Worldwide, yes. So it's something that is really killing a lot of people. So aside the age, the race, so the black population, so black Americans, black Africans, like the black population.
Why?
It's a race factor. So that's why I'm saying some of these things, like, they've not really identified specific things. But some scientific research will suggest some genetic predisposition. To such the race. There are a number of factors that I don't want to go so deep into some of those things. But race. So the race is also a major risk factor for hypertension. So the black population, that's another risk factor. Another risk factor is this smoking also comes inside again. So smoking, excessive alcohol intake. Alcohol can also really increase your blood pressure. So excessive alcohol intake can also increase your blood pressure. Salt intake. So those who take a lot of salt, high salt intake. So salt in the form of sodium chloride. So if you take more than 30 grams of sodium chloride in a day, that also increases your risk of hypertension. So one of the ways lifestyle modification is reduction in salt intake, especially the sodium chloride salt intake. So those are some of the risk factors that can predispose you to hypertension. Obesity is also one of them, as I always say.
You always say that,
yes.
the BMI.
So BMI greater than 30, obesity is one of the risk factors that can put you at risk of, and then your poor dietary habits.
Okay.
So if you don't eat very well to get the adequate nutrient that you need, you end up predisposing yourself to hypertension.
I see. Hey, doctor, better na me who say, because from what you are saying right now, from age 60, risk factor no you very very high, so between hypertension. And say okay, now me do sa age, you know, because I've realized that obi hon mo oba retirement at the age of 60. The me who say oba enche na bia wawu na de ne ko. Na fe ne life a anasa abrabo okobo nyina no na obi can say onya hwe mfiri mo. So can you tell us the signs bia odi be who say it looks like I'm getting this sickness, so I need to rush to see the doctor for, you know, for some guide, you know, the way I can live my life and all that.
Thank you very much. So one of the things that make hypertension very, very, very dangerous is that it typically doesn't come with any signs or symptoms.
Wow.
That is what makes it. So some people term hypertension as like silent killer. It's a silent killer. You may not show any symptom whatsoever. So that's why the importance of checking regularly comes in. Do you understand? So if you are advancing in age, so the risk factors are there. So the more risk factors you have, the greater your chances. So assuming you are someone, you're obese, you're a black person, you drink a lot of alcohol. Do you understand? You are advancing in age. And you have a family history. I forgot to mention family history of hypertension. So they say, "Be our papa now, mama, any more hypertension." It's sort of even double or triple your chances of getting it. That kind of thing. So if you have all these risk factors together, meaning that you have to be checking yourself very regularly because of the asymptomatic nature of hypertension. You may not get any symptoms whatsoever. So the only way to protect yourself is to ensure that you are monitoring your blood pressure regularly.
Okay.
That is the thing. You are monitoring it regularly. So if you've not been diagnosed with hypertension and you're advancing in age, right, you can check your BP. It's better to get the device like the device at home, the portable, the digital BP device, and then you consult your healthcare professional on how to appropriately use it.
Okay.
Or you can set some time apart. I can show how to correctly use the BP device. Maybe in another segment, you get a BP device and then I'll demonstrate how to use it correctly. But it will be better to get some of the device, or if you live close to a lab or a pharmacy, you can be going there regularly to check. So if you are advancing in age, like 60 years and above, you can check your BP like maybe once or twice a week, just to make sure that it's okay. So if you get a consistent and then it's consistently normal, within the normal range. So if you're above 60 years, that is below 150, 90, you can be reducing the frequency over time. But I mean, like, you should be consistent about it. Occasionally you can get some symptoms such as headache. Once in a while, occasionally, especially like if it's really elevated, you may begin to experience headaches. You may get dizzy sometimes, dizziness, palpitations.
Your heart palpitates.
Beats faster than usual. So the headaches, dizziness, palpitation. Sometimes you get uneasy. It's like I say, obuso funo, regional obuso, that kind of thing. So those are occasional symptoms that you have, but most of the time you may not even know. Sometimes when it gets persistently elevated, like you can go up to like even 200 and you really know.
Wow.
Yes, because there are a lot of times that at the hospital people will come. Do you even know, like, it's when they sit down, they check your BP and you're like, it's 200. I'm like, how's my BP 200? The person doesn't feel anything. Like, he's fine. Then by the time I realize, then
you are gone.
That kind of thing. So, I mean, you have to check to know. You can't base for hypertension. I won't recommend or advise you to wait for symptoms or wait for certain signs before you begin to start checking. You don't have to wait for, because it doesn't come with any major symptoms.
I see. So doctor said and say you might say, oh, you need hypertension, so maybe no unya device then you start checking yourself. Age. You rarely mention say like say 2 years and above, 2 years up to 3 years. You know, is it the secondary or the primary?
Primary hypertension.
Primary hypertension.
It could be primary or secondary.
But is it common in Ghana?
for very young children, it's not very common.
Okay.
I've not seen a lot of statistics on very young children.
Okay.
But like in our standard guidelines, they give ranges for very young children. So there's hypertension in children.
Okay.
So there are cases of hypertension in children being recorded in Ghana.
In Ghana.
Yes, very young children, 2 years, 5 years, and other things. And so in the Ghanaian guideline, there are BP ranges for very young children. So if you go beyond such BP ranges, they can diagnose a very young child of hypertension, and then they can put you on medications for hypertension.
I see. So apart from the children, no, younger people, I mean, young guys, young girls, and young boys, you know,
oh yes. A lot of young people are also being diagnosed with hypertension. When I talk about the prevalence being 60 years and other, we are looking at in terms of percentage.
Okay.
Do you understand? But it doesn't mean that the young people do not get it. But you have a high percentage of them being very elderly. But the young, middle-aged people are also, there are lots of them also getting because of the kind of lifestyle that you're having right now, because of the risk factors. You are a very young person, but both parents have hypertension.
Okay.
Do you understand? You're a black man, you drink excessively, that kind of thing, and then you're also obese. So you have multiple risk factors. And as a young person, especially if you also have diabetes in addition, your risk of hypertension greatly increases. So regardless of your age, you have to check for the risk factors that I've mentioned.
Okay.
If you have multiple of these risk factors, just be checking your BP regularly.
Yes. I see. So doctor, many hypertension no be if I say I've been diagnosed. Set me with hypertension. And my brain na a bit to me, science, my body. Now, and how do I manage it? Okay, this is it. I've been informed. I've been diagnosed. Madam, you say, oh, you're hypertensive. Daily lifestyle. I mean, science. And say, what do I have to do to manage it?
So, as I said earlier, hypertension is largely asymptomatic. You can be diagnosed with hypertension and be like, Doctor, okay. I care that a lot. Do you understand?
Okay.
Doctor, if you have hypertension, that kind of thing. It happens a lot. So you may not be feeling anything, but you can still be diagnosed with hypertension. And then you really feel anything. But you need to trust your healthcare professional, especially if the person is a professional and you trust the person. If the person diagnoses you with hypertension and gives you medication, please take it. And then consistently check your blood pressure. That's the only way you know if the drug is working or you are getting better. But from various case reports or like interview with people, you notice that sometimes, like when people stop taking their BP medications for a while, they get some feelings. Some people have their own way. That's why, like, you have to take charge of your own health. Do you understand? But as a person, you need to understand yourself. You need to understand your own anatomy before you even consult any other secondary person to assist you. If you really take your time to assess yourself, get to understand how your body, your physiology, do you understand? When there's a change in your body, you will notice it. You don't even wait for someone to, that kind of thing. So from case reports, and people actually get to notice, like people sometimes also feel it, that, oh, Nancy, I feel very dizzy. As I'm getting some of these palpitations near a day, I think say I'm a BP cholesterol, especially when they are diagnosed and they stop taking the drug for a while. They'll come and tell you, oh, as an answer, I'm checking BP, I'm sure. And usually when you check, you notice that it's going high. So it's important to understand your own physiology, but it doesn't mean that wait to feel something before you check. That's what I'm saying. But it's important to take charge of your own health. Do you understand? Before you even consult other people to assist you. So let's take charge of our own health. So if you are diagnosed with hypertension, you have medications now. The most important, one of the some of the things to do is, I've mentioned the BMI.
Yes. Try
to exercise. So you do 30 minutes at least. This is the list. At least 30 minutes of aerobic exercise 3 times in a week. So the whole week, if you don't do that is 3 times in a week. You do 30 minutes of aerobic exercise. So aerobic exercise is either your sprint, you sprint. So for the very elderly, you don't expect you to run or anything like that. So you can brisk walk. You can brisk walk around your house, or you can do a walk around the street or something. At least do 30 minutes. At least 30 minutes 3 times in a week. Very, very helpful. Over time, you not even really notice it. Just make it a routine. Make it a part of you. Do you understand? Even if you are not obese, like, just make it a part of you. Like every day you are walking or you are doing brisk walking. Do you understand? Those who are relatively young, you can skip. or you can do some of those aerobic dance routines. At least you are doing 30 minutes for 3 times in a week. So if you pick say Monday, Wednesday, Friday, you are good to go. If you can do more, it's excellent. Do you understand? But for the very elderly people, like, don't go too much. Don't do too much to exceed your limit. Do you understand? That's why the 30 minutes of exercise is fine. That one, everybody can do it. It's something 3 times in a week. It's acceptable for everybody. To ensure you be, and then incorporating more fruits and vegetables into your diet. Drastically reduce salt intake. There are some new studies saying that the salt intake directly doesn't really correlate with hypertension, but like those studies are now, like, if you happen to have chance on it, like, there are still more studies into it. So still for now we are sticking to reducing salt intake, like, because it's still a risk factor. So reduce your salt intake. As I said in our other segments, don't make the person stop taking salt unless your doctor asks you to stop. But like generally, like, the person will not really enjoy life. Like, let the person just reduce the quantity, but the food should have set some tastes so that the person can feel like he wants to eat more, so that it doesn't get deficient nutritionally. So the diet, so incorporate more fruits and vegetables into the diet. Reduce the unsaturated fats, the saturated fats. Reduce saturated fats and take more unsaturated fats. So the oils, try to take the sunflower oils more. Sunflower, olive oils, do you understand? The cod liver oils. They are usually rich in the polyunsaturated fatty acids, the omega-3, omega-6, omega-9. Those are the polyunsaturated fatty acids. So when I even buying oils in the market, you can just look at the label, look at the quantity of the PUFA, the PUFA, the amount of PUFA inside. So the higher, the more. So if you take the oil and the oil has more of the saturated fats, like, that is not good for you, especially someone has been diagnosed with hypertension.
I see.
So it's better to do more of the unsaturated fats. So the coconut oils, the cod liver oil, sunflower oils, those are very rich in the polyunsaturated fatty acid, and that is really good for such people. So and then generally the fruit and vegetables, the fiber, they are all really good. So if you compare these things, they are basic things that we can practice at home. So just make it a part of you and then start doing it regularly. So if you don't have hypertension and do some of these things, like, you reduce your risk of developing hypertension.
You are watching My Health Checks. It's all about saving lives with Dr. Bobson Ateko. My name is the Afro songstress Lily M, aka Maame Colors. I'm your host. And hypertension. Doctor, I can't send be brave for hypertension. I'm giddy say, and wow, what shame is CA? On shame so keke. What's your idea? I feel so. What subscribe and I will share. So the beya. Obi also ebenya dwumadie so home faso. But you say free break on so. Obi free ne na wan kasa wa your own self check. You say wan kasa wa your own doctor. So the beya hu se bibi eto chema wan kasa wa pomuden ho a quickly na no. Na wako o doctor ho na wahwe ho asem aboa waka na wanya hoden bisa pomden pade eno ne nkwapa se me so ko TikTok so a Lily MTV oko Facebook nso a Lily MTV na ba bia obeko bia no medofo omodi ase enam se dwumadie papa nti na eka ye nkwa ho asem nti na wo so wa share na onua bi nso anya bi na ono nso afamu aba. Doctor, the most question we say, can I stop taking my BP medicine at some point? If I think that, I'm fine, I'm feeling okay. Science be an answer, symptoms be an tete me and you may be an no. I feel the mea manuma drona me who's a form. I don't know be a side effect binti. Can I stop taking the medicine at some point?
So thank you very much for this question. Like, it's very important. You can't stop taking your BP medicines unless your healthcare professional asks you to stop taking it. You can't stop taking it on your own. See, when you do it's a medication you're going to be taking until you go for a review and then ask you that, okay, now you can stop taking the drug or something like that. But most of the time, it's a medication you're going to be taking for almost the rest of your life. In most of the cases, do you understand? And then now, like, technology or research has advanced so much that there are so many medications that we use to manage hypertension.
Okay.
There's so many different medications I can use to manage hypertension. So if you are taking a particular medication and then you're experiencing some side effects to the medication, if you are taking a medication, you develop renal toxicity or kidney toxicity, you develop liver problems, heart problems. There are always alternatives. There are several alternatives that I can take based on whichever complication you may be experiencing.
Okay.
So if you are taking your medication and you're experiencing a particular side effect or something, go back to your doctor, do a review, and then let the doctor change the medication for you, because there are lots of options available. So if the drug is worrying you so much that maybe it's depressing you, you are not feeling so good, there are a number of side effects of some of the medications. Do you understand? Some of them are not very pleasant. So if you are experiencing some unpleasant, you can report and then we change it for you. Some healthcare professionals are reluctant to change, especially obia yabrepa to maintain the BP in a particular range. Especially some people have what's known as resistant hypertension.
Okay.
Resistant hypertension. Yeah. You try the first line medications in Enfa. You have to try some other second lines before Sebefa. When you put you on such medications, complaining they're not really in a rush to change it for you. In such instance, please bear with your healthcare professional, because it's not so easy to be able to manage someone's BP like that. So in that instance, you can add on other medications to sort of control your this one, but not necessarily changing the medicines for you, that kind of thing. But do not stop taking your medications on your own unless your healthcare professional asks you to take. Okay. Not your family member telling you that stop taking it. And I say sometimes they'll be like, oh, me uncle be one no I do it kind of jay or what I say, but please don't
listen to them.
It's dangerous.
Okay.
Yes, it's dangerous.
Wow. So it means I should continue taking. So what are some of the common side effects? Maybe I will be hypertension and obesity.
Okay.
You know, and I think you've rightly said, you know, the person should quickly go to see the healthcare professional for a guide. But then, or the question, maybe I will name say, don't know side. So, what are some of the common side effects that you can?
So, generally speaking, like most of these antihypertensive medications, they are generally safe. Generally speaking, they are very safe, unless you have some organ damage already. You have some liver toxicity, renal toxicity or something. That's where some of them probably worsen it. But generally speaking, most of the medications are safe. Do you understand? They do not cause any severe side effects. So unless someone who has diabetes, you understand, and you take certain antihypertensives like the Benadryl, what's known as the thiazides, Benadryl, atenolol, and other things. Those medications can contribute one way or the other to increasing your blood sugar level. So usually people with hypertension and diabetes, if they have other, if possible, they put you on other classes of the medication, like the ACIs or the ARBs. So they put them on other classes that are even more beneficial in diabetic patients. But in situations where they have to put you on such medicines, you monitor your blood sugar closely to make sure that those drugs does not contribute to your blood sugar level, that kind of thing. So those are basically, there are some studies suggesting erectile dysfunction with some of the medications, but sometimes it's perception. Before the show mutin say, because Matisse say a drew bit my cause erectile dysfunction into like chinchina, I won't take it. Like they are scared of but most of the times, like the percentage of people that get is okay, those which are published, the percentage that are published is very, very low. Percentage of people who actually report of erectile dysfunction with some of the BP medicines is very low. So that shouldn't be a reason for you to stop taking your medicines. Even if you are developing something like that, there are medication that you can add on, you understand, to sort of control some of these side effects. Or sometimes you can even modify the doses or change for you. That is if that is that bad. So if clinically we assess you and notice that you have erectile dysfunction, and then we can sort of do an association with your BP medication, definitely need to change it for you. That is the rational thing to do. But that shouldn't be a reason for you to just decide that I'm stopping my medications generally.
Okay.
Exactly.
But Doctor Obia Bawankasa personally, yes, this is just for you to share your experience
Oh
on
yes,
this.
yes. I mean, I get it
When
a
your
lot.
member need be Omaba
Yes.
was a Bema no intimate and
Yes, yes,
because
yes.
of
Generally,
no.
yes. But I mean,
Okay.
you may not. Most of them are in their.
So how have you been able to help them?
Exactly.
What did you do for them?
So generally speaking, most of such people
Okay.
were in their. You say the andropause stage. Do you understand? Like
Okay.
the Adam, as I said. So
Okay.
they had this androgen deficiency in aging, so they were advanced in age. And then when you advance in age too,
Okay.
it comes with some of these symptoms. Do you
Okay.
understand? So generally, your sexual performance, do you understand, may
Okay.
not be as much as when you were young.
Okay.
So you cannot really draw an association directly that it was the BP medicine that is causing this erectile dysfunction or
Okay.
something. But for some people, genuinely, when they stop taking the drugs for a while, like they come back to normal, like as in their sexual function actually goes back to normal.
Okay.
So that was a reason for some people to even stop taking their medicine. As I was saying, there are alternatives.
Yeah.
There are medications, other alternatives that do not have that risk of erectile dysfunction. So if I assess you very well, sometimes they say even a questionnaire by some of the societies that you use to assess erectile dysfunction. So if your score is very high, suggesting that you actually have experienced erectile dysfunction that was not previously there before you started taking your medicines, definitely it can be changed for you.
Okay.
A change can be done to ensure that.
Okay.
So there are some patients that I've recommended a change in their medication. Some of them there's an add-on. I had to add another medication to improve their sexual function. That
Okay.
I do not want to mention some of those
Oh, no,
medications
you
because
don't.
so some of them you may have to add another medication
Okay.
to help control some of these erectile dysfunction.
Okay.
That's what I'm saying, that generally if you're experiencing any untoward effects with the drug, like just report it so that
Okay.
any alternative that needs or any adjustments that needs to be done will be done for you.
Okay.
Exactly.
Now, yeah, can does it also affect women you know,
so
their
for
sexual
women,
activities?
yes, you don't have a lot of reports of some of these drugs causing, with the exception of one of the drugs, methyl.
Okay.
So methyl, especially, usually they give it to pregnant women who have hypertension.
Okay.
Most of the time. So usually methyl can cause what's known as like postpartum depression. So usually postpartum depression is a thing that usually occurs like after delivery. The people go into depression, but you notice that people on methyl tend to have like it exacerbates the depression, that kind of thing. So for such people, if the depression is caught early, the medication could be changed for you. This same methyl also causes some problem in males too. So you don't get a lot of males on methyl, but usually if you put a male on methyl, meaning that like you may have tried the first lines and it's not working. So the only option is to put you on methyl. And then you may experience a few side effects with the methyl, but I mean, like as I said already, in some situations you may have to bear with your healthcare professional because at that point, that's like the best medication option. So sometimes we look at the benefits outweighing the risk. So if the benefit outweighs the risk, why not? They definitely institute it for you. So what is important is that like they increase, but there's something other things that we used to assess some of these things. They call the quality. The quality is like they look at the quality of your life. So if the drug is going to extend your quality by say 5 years, so a quality of 5 years means that you are going to have 5 years more of life, but with optimal health, you are going to be in good condition, you're able to go about your activities. But if you are given 5 years and all that 5 years is with impotence, no erection and other things, then that benefit does not outweigh the risk. So okay, like the benefit is not always up to just reducing the BP, but in terms of your quality of life too. Now there are a lot of healthcare professionals that are also getting some of these education. So we choose medications that can increase or improve upon the quality of your life. Such outcomes, that's what we are looking at. Improving the quality of your life. The DALI, that is disability assisted, like life that's without disabilities. You understand? So you are going to put on medicines that will improve your quality of life. So there are some medications that you do some of these calculations for you that if you are on this medication, you increase your quality by say 10 years. Increase your quality by 20 years. I mean that you are going to extend your life for about 10 years. It's an estimation, but that doesn't mean that after 10 at least you're going to have 10 years of quality life. And that is what usually most healthcare professionals are aiming at. And that is the benefits that you get from some of these BP medications. There are lots of them that even the complications, I don't know, maybe I'm jumping ahead, but there are lots of complications for hypertension. Hypertension can put you at risk of getting diabetes. Hypertension can cause kidney diseases.
Hypertension?
Yes.
I see.
One of the major problems with hypertension is the kidney disease. So most of them, people with severely elevated hypertension, it's important to check your renal function because it usually affects their kidneys a lot. So one of the complications can have it affecting your kidneys. It can cause heart problems, a lot of heart diseases. Less ventricular dysfunction. It can cause aortic stenosis, like a lot of heart failure. Can cause arrhythmias. Do you understand? Hypertension can cause a lot of heart problems. So the kidney, liver problems, it can cause peripheral artery diseases. Like the complication of hypertension, stroke, cerebrovascular accidents, so ischemic, both ischemic and hemorrhagic strokes.
I see.
All of those.
Stroke, we are more.
Yes, there are several.
Please, can you come again?
So you can have hemorrhagic stroke.
Hemorrhagic. I know you're saying.
Hemorrhagic is basically when there's a rupture of your blood vessels. No? So when the blood pressure increases so much that there's a rupture of the blood vessels, they begin to bleed into your intracerebral spaces. No? That's known as the hemorrhagic stroke. There can be ischemic stroke. Ischemic. Ischemic stroke means that there's ischemia. There's sort of a blockade somewhere, like in the blood vessels that supply your brain. So that the blood is not reaching some parts of your brain. That's what's really known as the ischemic stroke. And there's subarachnoid hemorrhage too. So there are various, and then all those, the etiology, hypertension is one of the major etiologies of some of these things. So the medications that it puts you on now, especially now with advanced research, most of these medications sort of reduces your risk of developing some of these things extensively. So some of the things that they use to measure the benefit of this drug is not just reducing your BP. Just reducing your BP, there are so many things I can take to drop your BP. But we are looking at the long-term effects of the drugs. Do you understand? So if you are just thinking about maybe right now that you're getting some small erectile dysfunction, think about the quality of life, like improving your quality of life.
The next 10 years.
The next 10 years, you're having good quality life where you can spend a lot of time with your family and all. So like there are now evidence-based medicine with lots of research, especially by the American College of Cardiology and the American Heart Association. They release a lot of guidelines with evidence-based medicines, and most of those medicines are available here in our local setting. Sometimes we don't really know them, so we don't know how important a drug like lisinopril, the benefits that you can get from taking lisinopril is enormous, especially for someone with diabetes too. Do you understand? So because we do not know, we do not really understand, but we get a lot of benefits from some of these medicines because intensive research, a lot of research had to go into it. Do you understand? Because of how hypertension kills people. So some of these medications protect you extensively from some of these things. That's why you don't have to stop taking your BP medicines. Sometimes you stop taking it for a while and then your BP may not elevate just like that. But after some time, you notice that you begin to develop a lot of complications because you're not getting the protection that you were getting, especially for someone with diabetes. So if you're getting a lot of protection from certain medication that you're taking right now, and you stop taking the medicine, even though your BP may not elevate abruptly at that point in time, but you notice that you've negated that protection that you were getting at that point in time. Do you understand? So it's like now your risk of the complications now begin to increase. That's why you don't want to stop taking your BP medicines. Like it's a problem. Do you understand? So that's why the regular checks is important. If you do your regular checks and notice that your renal function is deranging whilst you're on the BP medicines, your kidney function, your heart function is going down, then you quickly report. Do you understand? So at that point, you have taken charge of your own health. So, you've made it upon yourself that, every 1 year, I'll go and do all these checks to see. So you'll be comparing, so you have your data there. So from last year to this year, or from this month to this month, I've noticed that my kidney function is deranging or something of that sort. Then you quickly go to your healthcare professional, show them this evidence that this is what is happening. Do you understand? Then you check your medication. Okay, some of these drugs may be dangerous when your BP, your kidney function is reducing or something. Then we give you an alternative at that time. So at that point, you are taking charge. You're not even waiting for someone to come and tell you that your BP. So that's why the checks. I mean, the major relevance of this show is to ensure that you take charge of your own health and then go for the checks that you need to check with. So I mean, I won't advise that you stop taking your medication because of the complications I've mentioned. They are not pleasant. Do you understand? They are not pleasant complications. So you should be taking it. Most of the time, I say we come out and bear man, but for the females too, especially when you reach menopause. Do you understand? So before menopause, the prevalence of hypertension is more in males. But after menopause, it's higher in females because after menopause, the protective function that you get from your estrogen has reduced now. So now you are prone to some of these cardiovascular diseases. So females too, you also have to be very careful with your BP and also adhere to your medications. Very important. Thank you.
Abusiafo, asɛm no koraa bɔ me so. Nti sɛ waa wotie doctor na sɛ wonkyɛke wo health a ɛne na mɛserɛ wo sɛ firi nnɛ na kyɛke wo health ma kyɛ sɛ bɛyɛ wankasa wo ho doctor yɛ wankasa wo ho na mu nhwehwɛmu yɛn nyinaa yɛdi fɔ medim sɛ woahwɛ me so wodi fɔ papa sɛ wodi fɔ sɛ wankasa wahu sɛ wodi fɔ wonhwɛ wo health so yie nti yɛmfiri nnɛ doctor sɛ yɛmfiri nnɛ because sɛ yɛka kyerɛ sɛ woanya hypertension a ɛho nsonsansoɔ no ɛnyɛ borɔde aberewadwoɔ ɛnna fam ɛho nsonsansoɔ no mu ɔden yɛ fi sɛ mia na ho bi na ho no wɔ bi a abrante kwa a wonyini no baabi a yɛsɛ wɔnya hypertension ɔbɛdɛ no wagye adi me kura nka me nyini fi sɛ me nsɛ me sua so doctor sɛ age nka ho obi a betumi anya ɛna wonya wie nso a ɛyɛ na wa mo waduro no ho ahia fi sɛ ɛduro no side effect bi anim saa kakra wɔ mu nso wo sɛ mefa yɛ sɛ na ɛyɛ me na ko hu doctor they also healthcare professional. It can be a pharmacist, it can be your GP, your general practitioner, whoever is your healthcare practitioner. No, you have to approach that person and then tell the person how or what you are feeling after taking the hypertension medication. We understand, yeah. But now come watch if you say a home sunsun is not pleasant and you're interesting and you're there fine and you're there so air there. Ubetimi stroke, ubetimi say kidneys. Oliver,
yes.
Betimi aka. Sabe Obama betimi adojo. Nima pii ena eto yen. Eno nti ese ye check your health. So my health checks is here to save your life. And I have my honorable doctor here with me all the time, Dr. Bobson Ateko. Doctor, baby, I buy any vitamins. In some man for vitamins, no, or more fat at the year Juma. And today, a mania hypertension. I did vitamins, and I say, oh, cancel now the Biane Papa is me this so why?
Okay, so essentially, the vitamins that we take, baby, they said they are you can do dietary supplements. Do you understand? Once in a while, they help. I'm not saying that you always have to be on dietary supplements. Sometimes, like even your diet and kasano, I'm sure your diet is very well. You may not necessarily even have to be taking the dietary supplements, but it's important that once in a while you get your dietary supplements, especially the B vitamins. They are very important. So the vitamin A, vitamin B, the vitamin E.
Okay.
All very important.
Vitamin B, vitamin A,
vitamin
C,
vitamin E,
and E.
Yes, the vitamin D is also very, very important. Essentially, all the vitamins are also very important. And then for the men, like some of these ginseng supplements, so some of them they come as a package. You may have all of these with ginseng, CoQ10, with CoQ10 and the polyunsaturated fatty acids, DHAP, all of those things inside, like I said, combined products. So once in a while, you can get some of these medications, the dietary supplements to take it. They are very helpful, to be honest with you, because some of these, the ginseng and other things, they improve blood circulation. They help to improve blood circulation. The polyunsaturated fatty acids reduce the bad cholesterol. That's the LDL and VLDL cholesterol. They help to reduce them and increase the good cholesterol. So if you're on some of these dietary supplements, they help a lot. And then you combine that with good dietary. You eat well, incorporate more fruit and vegetables into your diet, that kind of thing. And then the exercise in there, let it be part of you.
Okay.
I mean, like, don't make it a chore. Don't make it seem like, oh, I think like, let it be part of you. Say, oh, every day you know that I have to do 30 minutes of aerobic exercise.
Okay.
Just 30 minutes. You can split it if you want. You can do 15 minutes in the morning, 15 minutes in the evening. But just do 30 minutes aerobic exercise at least 3 times in a week. Do you understand? The regular exercise is better. And then because of hypertension, how hypertension is silent, the regular checks are important. Especially when you're advancing in age. The young people too, don't undermine hypertension. You can all develop hypertension. So you can also be checking your blood pressure regularly to make sure.
Now, Adriana, no, I remember the last time you came, you mentioned say, so di Adriana, oh yeah, diet now, 60% of carbohydrates, and then 40% of vegetables or greens. Can I have clarity on this?
So usually the guideline recommend that when you are eating the carbohydrates, you take like, so maybe you take the whole plate. So the plate that you are eating, as say 100%. So 60% of the whole plate, do you understand, can be your carbohydrates. But the carbohydrates, they usually stress on the complex carbohydrates than the simple carbohydrates. So the complex carbohydrates, based on our diet, that's what I'm saying. In Ghana here, we eat a lot of yam, the cassava, plantain, potatoes, and then fufu, because fufu will have all of these. All those are complex carbohydrates, and they are really good because they are released gradually. They have to be broken down into what's known as monomers before it to be absorbed. That kind of thing. So those ones do not elevate your blood sugar like that to put you at risk of getting hypertension, that kind of thing. So usually it will be better to, if you are eating the 60% carbohydrates, more of it can be the complex carbohydrates. Do you understand? Then you have about 15% of proteins. As I said already, proteins increases satiety. Until with the proteins they can't so you don't even have to eat a lot of the carbohydrates. So more of the, and then the fat, we recommend that plant source more than the animal source. So the plant source of fat is very important. Like the banana, the pear, they all contain, they are all plant source of fat that you can be taking out, really good for you.
So essentially, it's not a bad fat.
No.
When you are taking a lot of
the
pear.
Pear,
I love taking pear a lot. Yes, so sometimes I get scared thinking that, hey, am I not storing more fat into my body?
I mean, the plant source is really good, as in more healthy as compared to, but like, I mean, the animal source is also good. I mean, the best source of protein and then fat is from the animal source, essentially. But especially when you're advancing in age, you want to cut down on the animal source and then do more of the plant sources. More often, that kind of thing. So basically, that is the dieting, the approach I'm taking. And then you reduce the salt intake too also.
I think so, Doctor, you've kept on mentioning the reduction of salt over and over. Okay, like I said, hypertension for no dear, and children no say a test one kasa. Any BP, and any hypertension. BP,
blood pressure. So a minimum friend of high blood pressure.
Okay.
So another name for hypertension is high blood pressure. So BP for short.
Dear, and children dear, yes, doctor say my kura on kasa jai di kura name teso na ebeboa. The doctor, and tis a medidi. Na ja. When you can say 60% carbohydrate, na me so me pe fufu yi. Then me fufu yi. Me trying to say me measure say 60% and 40 there. Say me fufu ni me trying to say kuntum. All them say yeah black tea yeah try say ye dia ankasa. And they okay they na me di pa o say me do the 60% na me di me bam at once. Na me de e friend say na ntwinam kakra abo ha. Na me de maybe a manual business class and Guana media. The Akraba said you have protein and so is it right? So when you can 60%, may di carbohydrate here, na may di now 40 now can 50-50 they say so. So how is it going to benefit me?
Okay. So essentially with calculations, there are specific ways that you can calculate a specific amount of calories. So the general all of it to be converted to calories. And I said, I mean, like they'll give you some amount of energy to work, that kind of thing. But you want calories like asking from different sources, that kind of thing. So there are ways that you can calculate the number of calories that you are getting from particular portions. There are calculations on it. So I mean, like one of these days I'll come, or maybe you can invite a dietitian, or I'll bring a chart. There's a chart. So they locally, like maybe a slice of plantain will give you this amount of calories. A bowl of banku will have this amount of calories. That kind of thing. So that is the idea behind the percentages that was making. But I mean, for someone who do not know some of these calculations, you can't go and see a dietitian or anything. Basically, just look at the plate. Generally, I've said that don't eat so much at a time.
Okay.
Do you understand? So the little food, I mean, you can eat in small portions.
Okay.
But the little food that you're eating, because of how we eat here, no, usually the greater percentage of our food will be the carbohydrates.
Okay.
So you try to incorporate more of the complex carbohydrates. So generally a higher percentage. So it doesn't, because I've said 60, it means that always there has to be no.
Okay.
Sometimes it can be even smaller than the additives that you add.
Okay.
So generally you can have a very small bowl of fufu with more soup and then more of the lean meat, or fish. The fish, that's where you get the fish oils. They're also really good. And then you add onto your diet. But with regards to specific calculation and all, I mean, we have to get a separate segment and then we talk about that, like rationing. But the other day I mentioned something about dash dieting. So the dash dieting, they explained it in ways that a patient or an ordinary person can read and even understand it. So the DASH, when you read about dash dieting, it gives you a comprehensive approach to how to change your diet to reduce hypertension. So you can all look up, those who can, like look up DASH, dash dieting. And look at how the dash dieting, they explain how to go about it to an ordinary person.
And Mr. Doctor, wakasa about sa dash dieting say reduce your risk of getting hypertension. Google, you can take your phone and Google dash dieting, and then you can be directed very well as to what to eat at what time, and then the quantity of the food that you take and all that. That will be a guide for you. Now, wakasa bebre so far yedi die mo. Wakasa bebre fa ye my vitamins I see if mra wanya hypertension and now say unya bi kura no doctor my vitamins bi was prescribe am for free, that you should be taking them at the comfort of your own home. You just go to the pharmacy and get those vitamins, and then you take them and you say, Safe na waba say, yeah, please. Doctor says that he's ready to answer all your questions. He's ready to give you a call. Say, here. So bibi na here say doctor see board and then or you share about comment section hona, what your comment about to hona here say ofrewa. Just leave your contact number there, and then the doctor will give you a call, and then you come to see him, and then he'll give you all the guide and directions you need to get in regards to your health. However, you can also leave your comments. The BL person Busa Doctor BL program is to be you are free to do so. Please ask all those your questions, and then we'll come here to the studios, we'll mention your names, and then we'll answer your questions one at a time. You are the reason we are here. Without you, we can't be here. You are the reason we are here. So we are here to save your life, give you all the guide you need with regards to your health, and to leave your comment here, and we'll come and answer all your questions so that you also have a very, very healthy lifestyle. I am said Dumadino, and I had the Yanki at so it is so sad here ponda, and so a beano I be. Until all too soon, we have come to the end of this segment, but we'll take doctor's final words of encouragement before we leave the studio.
Oh, okay. So thank you very much once again. To say that, I mean, like, let's all try to take charge of our own health. You understand? Let's always check our own self every time. Make sure that everything is going well, and then taking charge of your own health means that being very conscious about your health. I mean, the point is not to scare anybody. You see, there are a lot of things that you said. But if you want to live a very happy life, a comfortable life, a long life with your family, just take into consideration some of these things. Take charge of your own health, you understand? And take certain steps for your own self to ensure that you are going to enjoy long life, do you understand? With your family or your friends. Exactly. So with the hypertension, like, it's a very broad topic. There are things that you do not understand and other things. As Maame Colors has said already, you can leave your comment there and I'll attend to them. The dieting, like all these fruits, the garlics, the ginger, they're all really helpful, especially with blood circulation. Do you understand? So you can be incorporating a lot of these into your diet, and then it can be very helpful for you. I mean, thank you again once again, and then let's take charge of our health. Thank you.
Yes, indeed. Doctor says that we should take charge of our health. Yan kasa yan fire ho den anase apomuden enhye yen sa se ye behwe ye ho so eyiye. My health checks, saving lives with Dr. Bobson Ateko. I want kasa mo so for him afro songstress Lily M aka Maame Colors me na dwumadie yi me de ho chia me da ma sese nne nso mo hwe yen da se nne e besa ne aba makramo